Hi, I am Dr. S.S. Vanani, a surgical gastroenterologist. Today I am going to speak about hemorrhoids. What are hemorrhoids? Well, hemorrhoids are actually vascular cushions in the anal canal above the dentate line. So, imagine this is the anal canal. You can see the folds here. Hemorrhoidal cushions are also there around the anal canal. The main function of hemorrhoidal cushion is it will actually help us to occlude the anus. Also, it has certain sensors, so it will help us to differentiate between gas and the hard stools. So, what is hemorrhoid is whenever these hemorrhoidal cushions prolapse down and start bleeding, then it is called as hemorrhoids or piles in common term. Why it will happen is these hemorrhoidal cushions are attached to the wall of the rectum and anal canal through the anchors. These are the fibrous anchors. Whenever these anchors get damaged, it will prolapse down. Whenever it prolapse down, it is called as piles or hemorrhoids. So these patients with hemorrhoid usually present with painless bleeding. Patient will pass blood drop by drop. Sometimes spurt will be there if hemorrhoids is very big. Most of the time this bleeding is painless. So whenever a patient has got a painless bleeding at the end of the passing motion, if they are passing drop by drop, most of them will have a hemorrhoid. So how do we diagnose it? Whenever we go to a surgeon, we just do a rectal examination, digital examination, and we do a proctoscopy. Most of the time we will come to know what is the grade of hemorrhoids, how bad it is, how soon we have to do the surgery. So once hemorrhoid is diagnosed, how to proceed? So whenever hemorrhoid is diagnosed, in young patient we won't do much, we straight away offer the surgery. In a patient who is above 45-year-old, my practice is almost all patients, once they have hemorrhoids or any bottom problem or renal problem, I subject them to undergo colonoscopy, because after 45 years any recent onset of perineal disease may be associated with colon cancer. So around 10 to 20% of them will be having high chances of developing colon disease. So we subject them to colonoscopy. Once colonoscopy is done and it is ruled out that they have no other major issues, then we plan for the surgery for hemorrhoids. So treatment of hemorrhoid, wide variety is there. We do stapler hemorrhoidectomy, we do laser hemorrhoidectomy, we do conventional hemorrhoidectomy, and we do something called chivate hemorrhoidectomy. All these procedures we have to sit with the surgeon and decide what are the pros and cons, what are the benefit. Of late I see patients calling me, sir, we have hemorrhoid, can I do laser surgery? They think that laser is one stop solution for all hemorrhoidal problems. No, it is not like that way. So you should not demand that you want laser or you want this or this thing. You should discuss with your surgeon what are the options for this kind of hemorrhoid. Based on that we will plan the surgery, because if a grade 3 hemorrhoids are there, grade 4 hemorrhoid is there, laser won't give much benefit. It only add to the cost of the treatment, but result is not very good. Laser is very good results in grade 1, grade 2 hemorrhoids, whereas grade 3, grade 4 hemorrhoids will be managed very differently. Suppose a patient has got a prolapse hemorrhoid or grade 3 hemorrhoid and lot of mucosal prolapse is there. These kind of patients will benefit from either stapler hemorrhoidectomy or suture hemorrhoidopexy or chivate procedure. Grade 1, grade 2 is there, their extensive hemorrhoids are there. These are the actually patients who benefit significantly from laser surgery. What are the risk factors for developing hemorrhoids? Are mainly hard stools. Patient will having constipation if their fiber content is very less, and patient is straining while passing motion, and sometimes hemorrhoids is genetics. Treatment for hemorrhoid is proper diet. So patient should have lot of vegetables in their food. Hydration is very important. Usually grade 1, grade 2 hemorrhoids, patient is not very frequently bleeding, maybe once in a year, twice in a year. We don't do any surgery, we just observe them regularly. Hemorrhoid is also like hernia, is a dynamic disease and a progressive disease. Over a time, what is grade 1 can become grade 2, what is grade 2 can become grade 4, what is grade 4 can become like a prolapse hemorrhoid, thrombosed hemorrhoids and all. So these patients, if they treat them in earlier stage, they very unlikely to develop. They will have a cure with a better result. Whenever hemorrhoid is there, go to your surgeon, discuss with them what is your problem, see what grade of hemorrhoids you have. Based on that you plan the treatment. Don't go and demand the surgeon, ask, I want a stapler, I want laser, I want that, I want this, because it doesn't help you, because surgeon is a better person to decide what kind of surgery will be appropriate for you guys.